This episode of AHA's From the Soapbox podcast is generously supported by Merck Animal Health.
From the Soapbox is the official podcast for the American Animal Hospital Association's digital newsroom, Trends. Here, we take inspiration from the familiar soap notes, but instead of looking at the condition of a patient, we're diagnosing and discussing the state of the veterinary industry. We'll chat about the challenges, trends, and innovations shaping the veterinary world with voices from across the community. I'm your host, Dr. Emily Singler. Thanks for listening. Hey everybody, welcome to another episode of From the Soapbox. My guest today is Dr. Addie Reinhard, veterinarian, CEO, and founder of MentorVet. Her story is truly inspiring. She took her experiences with burnout in vet med and her love of learning and entrepreneurship to create mentoring programs for veterinary professionals of all stages and in all roles. Her time in grad school also paved the way for her to join the research committee conducting the Merck Veterinary Wellbeing Studies, which for the first time in 2023 conducted separate studies for veterinarians and for other team members. We talked about some of the results and how non-veterinarian team members had higher rates of burnout and some mental health challenges in comparison to veterinarians who responded. We talked about some of the ways that we can all continue to address these concerns so that more of us in vet med can feel like we are flourishing in our careers. And we talked about what she's back in school studying now, along with the future of the Merck Veterinary Wellbeing Studies. Without further ado, getting her time to talk from the soapbox, Dr. Addie Reinhard. Dr. Addie Reinhard, thank you so much for joining us on the podcast today. I'm so excited to have you here.
Thank you for having me. Excited to chat with you.
Yes. And we spoke a while ago for the mentoring toolkit. You helped us talk about some of the links between mentoring and well-being. So I'm excited to talk to you again and touch on some of those topics and then go into some new stuff. But I would love, just for those who maybe don't know your whole story, for you to share a little bit of that, whatever you would like to, in terms of how you got from either starting with vet school or being a practicing veterinarian to where your journey has taken you now, like whatever you want to share with us.
Amazing. Yeah. So I was not the always wanted to be a vet forever person. I actually wanted to be a vet, I think maybe 2 years before I went to vet school. And it was kind of this intersection of the things I always enjoyed, which were kind of teaching and education and science, and bonus, I get to work with animals. And so I did vet school. Upon graduation in 2015, I worked in general practice for about 3 or 4 years. And through that experience, I had burnout a couple of times, I think, like most early career veterinarians in their first few years of practice. And fortunately, I had some really good mentors in and out of practice to kind of help support me through that. And I think the more openly I started becoming about my experience, the more I recognized how I wasn't alone in a lot of the feelings that I was having, and a lot of my classmates and fellow early career vets didn't really have the same resources as I did, and I had a great support network at the time to help me through that. And I really felt this calling to be able to support others who might be having similar challenges. So I decided to go back to school. I got my master's in community and leadership development at the University of Kentucky. I essentially spent 2 years there researching early career well-being, but more importantly, what can we do about it? So most research that we see in the veterinary well-being space historically for the past 20 years has really focused on kind of what is the problem and why does it exist. But I wanted my research to focus on, okay, we know there's a problem, we kind of know why it exists, so now what are we going to do about it? And so a lot of my research is interventional based. So we developed the first iteration of the MentorVet LEAP program for early career vets back in this summer of 2020 was when I piloted it. So fun time to be launching a new program. And I think through that pilot really recognized the importance of peer mentorship and professional skills training to give early career vets kind of the skills and tools and community that they need to be able to be successful in the transition to practice. So our early research kind of showed reductions in burnout compared to a control group. And at that stage, I was like, all right, I'm going to finish my master's. I'm going to be a relief vet, maybe do this on the side. Well, one of my mentors, Dr. Elizabeth Strand at University of Tennessee, connected me with leaders at Merck Animal Health. And they scheduled a meeting with me and to learn about my research. And I think from there, I didn't really have any expectations of what it would become, but I showed them what I've been working on, and they wanted to help me grow that. And so in the spring of 2021, I finished my master's, and I also founded MentorVet, the entity, because I had Merck coming as a founding sponsor and some money coming in to help grow the thing that we were doing. And then from there, the past 4 years has just been, like, really sprinting to get this thing off the ground. We've helped thousands of people now, and we have not only programming for early career vets, but, the rest of the veterinary team, because I recognize that all these issues are kind of interrelated with well-being, and, when our team is happy and healthy, then our vets are happy and healthy as well, and vice versa. And so, what started off as kinda create a national mentorship program at MentorVet became developing evidence-based programming to offer resources, support, and community for anybody in the veterinary profession at any stage of their career. And with the 5 programs that we have now, we're helping vet techs, mid-career vets. We have a veterinary mentor certificate program, and we run the paired mentorship program for the American Veterinary Medical Association. So lots of things happening at MentorVet, and that's my full-time job. So that's what I've been focusing on for the past, I guess, 6 years now, which is pretty wild. And yeah, I still do some things like speaking and things like that, but this is my main priority. So
Wow, that's incredible. And that's so I don't know if I ever heard that part of the story before where you were in your research stages and maybe didn't know what like you said what it was going to turn into, but your research and your passion for it and the things that you had started working on were so inspiring that you were able to get this huge founding sponsor
yeah.
to help get things off the ground and turn it into what it was today. I was going to ask you, like, were you like also studying business? Were you like planning that you were going to go out and like create this company when you were in school or
No, not at all. I am like, so my dad hasn't always been kind of an entrepreneur, and I saw his life, and I always told myself, like, I was never the person that wanted to own my own practice or anything like that. I was like, this is a lot of work. Like, I just want to be an associate and clock out at the end of the day and have vacation. And it's funny because I think for me, a lot of the journey creating this thing was kind of accepting my role as an entrepreneur because I didn't really want to be a business owner ever. And so, but I think realizing that I think I was so passionate about this project that kind of fueled me into this role. And I during grad school was really studying. It was a time of exploration for me because I knew I wanted a career transition. I knew I didn't want to be in clinical practice full time anymore, but I didn't really know what my next step was going to be. And so the whole point of grad school was to give me 2 years to explore different areas of the profession, whether that be public health or industry or research or whatever. And so it's funny that giving myself some time and space and exploring my interests kind of led me where I needed to go. So yeah.
yeah, that's such a good point because I think there are a lot of people who have had similar thoughts. We're like, I don't think I want to keep doing exactly what I'm doing right now, but I'm not sure what's next.
Yeah.
So,
Yeah, school's always been a safe space for me to kind of explore those interests for sure.
yeah, I love that. And then so you've had Merck as this founding sponsor for a while, and then is that how you became involved in the Merck veterinary well-being studies as well?
Yeah, so it's kind of funny. I think doing this well-being research during grad school, I always like idolized these researchers on the Merck well-being study, and I was like,
Yeah.
maybe one day if I have enough research published and I'm a good enough researcher that they'll maybe invite me onto the research team of the Merck well-being study. And it's funny because with this partnership establishing between MentorVet and Merck Animal Health in the spring of 2021, the individual that I was working with at Merck just kind of popped me an email, and he's like, with you being involved now with us, like, probably makes sense if you want to, if you want to participate, be a researcher on the Merck well-being study, and just like no, like so nonchalant about it. I was like, "Oh my god, this is just like my dream role, you know? So yes, please." And so that kind of fell into my lap, and it definitely aligned with what I had been working on because I could kind of bring that early career perspective to the research as well and to the research team. So I started with the research team in the spring of 2021, and I've done 2 waves of the study with Merck Animal Health now. So I've been kind of pretty involved in both kind of the research process as well as kind of the presentation of our findings as well.
And can you talk about, like, I know you said you weren't involved in maybe, like, the first one in, like, I think it was 2019 was the first
Yeah, let's
round?
see, or 20, maybe even 2017. There's been, like,
Oh,
kind of
yeah,
4
you're right.
waves. I think there was it's funny, I always say Merck cared about well-being before it was cool. Like, before anybody was talking about well-being, they were doing these well-being studies. They said in some of the first, like, presentations, there'd be, like, 10 people in the room to learn about the research, and now it's just, like, such a, important study. So, it's been every 2 years, I believe, 2017, 2019, 2021, and 2023, were kind of the 4 waves.
What was the initial reasoning or sort of motivation behind starting it back then?
Yeah, I think at that stage, and just thinking historically about the research, there was a lot of research coming out of the UK and New Zealand and Australia on kind of well-being of veterinarians. Some of the earlier studies were in kind of the mid or early to mid 2000s. And there had been some work done there, but there really at that stage hadn't been a lot of work done to understand the well being of veterinarians in the US specifically. And so I think Merck kind of, I think always kind of has this commitment to supporting veterinarians in the veterinary profession. And so with that, I think original reasoning behind the study was just to understand the problem more and figure out like what's going on here and then what can be done about it and what kind of resources might be able to help support this issue. Because I think working so closely with so many practices across the country, I think that it's just something that was probably talked a lot about in all vet clinics, and so clearly a need of understanding this issue and providing resources, which is kind of the exciting part of where MentorVet came in because they, at that stage, had had 2 waves of the studies done showing the issues. And specifically in those first 2 waves, like for young vets, were at the highest risk for a lot of these mental health issues like burnout or serious psychological distress or things like that. And so I think seeing that they wanted to partner with a group that could provide resources and support, and which is why, the partnership kind of started in the first place.
I was thinking earlier when you were talking, I was tempted to say something like you had kind of like manifested all these things that you wanted, but I stopped myself because I'm like, no, you did all the work. Like you did everything that needed to happen for you made the comment about these things fell in your lap, but like you did all the work.
Yeah.
You had the passion, you had the drive, and you did the work. So
It's like such a combination of being in the right place at the right time, but sometimes being in the right place at the right time happens because you've been putting the work in and kind of following your passions and kind of doing it right. And I think that um, when I first started this project, like, I didn't have to reach out to Elizabeth Strand at University of Tennessee. I was actually pretty scared, like, she's one of the leading experts in the field, and, I went to vet school there, and she kinda knew me from vet school, but, I didn't have to kind of go out of my way to drive down to Knoxville and meet with her to see if she wanted to collaborate on my project, but I did anyway, and because of that, and she worked with me on the project, she saw, just how impactful this thing was and was able to use her network and connections to connect me with other people. And so, yeah, I think a lot of the success of MentorVet has come not only from my work, but from like the networks of connections that I've established and just being able to put myself out there a little bit, even when I might feel uncomfortable or not qualified or, all the imposter syndrome things too.
and would you say because I feel like I've said this to other people because I have first of all, I think like technology and like doing things remotely has helped me a lot because I'm a lot braver, but probably through my computer than I would be like just walking up to a person I don't know when they're standing right in front of me. But Um, would you say that for the most part, like when you reach out to people, that most of them, when you ask them to talk about what they're passionate about in their field of expertise and can they share that with you? Like, I feel like most of the time most individuals are very excited about that and very
Yeah,
open about that and
it's been
wanting to
interesting.
collaborate with others. What's your experience been?
Yeah, I think for me, it's been kind of, like, mixed, especially early on, and I'm thinking about, like, when I first started with my research and before it was kind of like a formal entity, kind of like in the early stages of creating this thing, there were definitely people who were very excited to talk to me about it and very open. But I think there was still like a lot of people that were maybe skeptical of who I was or what I was doing. And I would reach out to them via email and they would just not even respond back or ghost me. And I got that a lot starting out, but I think the the person who can, like, really bring something into reality is one that can continue despite those no's, and I just remember because I had mentioned my dad was an entrepreneur, and I very early on, I said, like, "Oh my gosh, I got this no," and I was really bummed about it and felt like, "Should I quit? Like, everybody's saying no to me," and my dad was like, "Addie, like, no's are just part of it, and for every" one yes, you're gonna get 10 no's, and that's just part of the process, and so I think getting to the next stage of growing something is often, like, fighting through those no's and just, like, not spending your time there, and instead, like, focus on the yeses and the people who are excited about the thing that you're doing, and then what I found is after a few years, a lot of the no's became yeses or became, "Let's talk about it," because they could see, "Oh, like, this is actually working," because at the time, like, the way that we were doing mentorship was so foreign to so many people. I think people have a very traditional definition of mentorship as this one-on-one relationship with somebody more experienced and somebody less experienced, and that's in their mind what mentorship is, but we at MentorVet kind of redefined what that meant, and it's not just this paired mentor relationship, it's all of these, networks and connections that you make in the industry to support your career, so that might be peer mentorship or mentorship from others who are like you, or might be reverse mentorship where you're learning things from people who are less experienced than you, or getting mentorship from team members. And so it can be so many more things than just this paired mentor relationship. So I think it took a while to kind of change those perceptions on what mentorship is in the industry until we started getting more yeses. So
Yeah, well, I mean, that just goes to show, like, you can't give up.
yes, correct.
You can't give up. I mean, you knew you had a great idea and you had and I would imagine too, like, just having the support of a few individuals at the beginning who are giving you those yeses, who are telling you to keep going, telling you you've got something good to keep going forward with it. That must have been really important.
The people around me were definitely, like, why this is where it is today, and I've had so many good mentors that have really pushed me and supported me and, yeah, to make this thing a reality. It's definitely not been just me, but, having lots of good mentors to help support me along the way.
And I wanted to talk about the 2023 well-being study because as I understand it, that was the first year you kind of divided out. You had like a separate study for veterinarians and then one for team members. Um, had before, like in previous years, like 2021, 2019, 2017, was it a study of all team members of the team combined, or was it specific to veterinarians?
Yeah, so for the first 2 waves of the study, the 2017 and 2019, it was focused on veterinarians specifically. So we hadn't included the team in those early studies. But I think as we went forward, we're like, oh, well, I think the team is very important at understanding this issue as well. And so the first time we started including team members was in 2021. But in that first study, we didn't get a ton of responses from team members just from the way that we surveyed. It was like a pass along survey method. So we would email the vets about the well being study. And if, they complete it, we say, "Hey, pass this along to team members so that they can take it as well." And just the recruitment, we didn't yield as many respondents as we would have liked in that early study in 2021. But we did get some preliminary data kind of showing like, oh, hey, the team might be in need of some help. And so in 2023, we opted to really do a deeper dive on team well-being and specifically kind of stratifying it out between jobs, veterinary technician, veterinary assistant, practice manager, kennel attendant, and kind of stratifying out what is the well-being like of each of these team members. And we got a lot more responses this last study. So we got, I think, around over 2,000 responses on our team study. So it feels a little bit more reliable data. Not that the first one wasn't reliable, but this one is just like, more power in numbers. And we kind of were able to compare to like the team to veterinarians as well and kind of where we're at with well-being for both.
Yeah, I was looking at some of those results and I saw, team burnout levels and exhaustion were both like higher than the general population in the 2023 study. And in some cases they were higher like between team members and veterinarians, like the team non-veterinarian team members
Correct.
had some higher numbers on at least some of those things.
Yes.
And I think some of that makes a lot of sense because, veterinary team members are their job can be very physical. They have long hours. They're doing sometimes a lot more lifting, bending, getting up and down, like holding animals, that kind of thing. Mental exhaustion as well. Um, but what else like stood out to you about the differences between like veterinary teams and their responses versus like the veterinarians and their own
Yeah. Yeah,
study?
I would say the main thing, like you hit on, was kind of the higher rates of burnout among the team and just higher rates in general of some of these mental health challenges. It is interesting. The age demographic was different because a lot of the team members are skewing on the younger side. Whereas, like from the veterinarian data, we have data from kind of all stages of the veterinary career, and there's this kind of clear path for vet. But for a lot of the vet team, a lot of I'm sure the issue is just kind of retention within the profession of a lot of our team members, and so not many team members are staying past 5 years in the profession, and so a lot of the individuals and the respondents from the study were trending towards the younger age, and I would say that, when we look at the breakdown, pretty much any mental health measure that we looked at was, a little worse for our team members. I would say practice managers tracked pretty closely with veterinarians, and I think that some of that may be related to financial well-being as well. So I think a lot of our team members, financial stress is a huge concern, and that can definitely contribute to a lot of these other challenges and feeling, underappreciated and things like that. But I would say for a lot of the team members in general, the well-being scores, the burnout scores looked very similar to early career vets, and so they were kind of very similar in that way. Whereas like mid-career, later career vets and practice managers, still sometimes worse than the general population on some of these measures, but not as bad, I would say, as some of the early career vets and for the team members. I've done so this is, if we look at kind of veterinary team members in general, we did at MentorVet, like, a qualitative study. This was about 2 years ago on kind of stressors of veterinary technicians and some kind of things that are unique, and you mentioned a few of them, like the physically demanding nature of the job. It's just like it's a hard career path on your body. But one of the big things that pretty much in all of the focus groups and the group interviews that we did was this aspect of feeling like they weren't being utilized or leveraged to their fullest potential. And that underutilization kind of contributed to their stress and to their burnout in practice. And also kind of this feeling of like helplessness at times. I think when you're a team member maybe feel less able to implement change as maybe a practice manager or a veterinarian might be able to advocate a little bit more for change. And so I think that power dynamic and hierarchy that we sometimes see in practices can also contribute to feelings of stress and burnout as well.
Yeah, I was wondering when you were saying that practice managers tend to track a little higher with some of the well-being than other members of the team. I was wondering if like autonomy was a part of that as well. Like both autonomy in terms of what you do and like your physical job description and how you do your work, but also like autonomy over your schedule, autonomy over when you get to work, autonomy when you leave for the day, what days you work. Like I can imagine there's probably a little more of that, like, in the more of the management roles, and I'm wondering if that is a factor or if that's something that you've gotten much feedback on.
Yeah, I don't know that we looked at it specifically with the Merck well-being study, but I do know from like the general burnout research in all professions that autonomy over your schedule and flexibility over your kind of work role and work responsibilities is huge for uh, kind of reducing burnout. And so individuals who feel more autonomy in their role, whether that be the tasks that they're doing or the schedule, if I'm an early career vet in a practice where um, I maybe say I really hate cat dentals, and I really do hate cat dentals, and this is a true story. And if I said, hey, Dr. Smith, Smith is a pseudonym, but if I said, hey, Dr. Smith, like I've tried cat dentals. I have been working really hard on my skills to try to be better at it. And I just these stress me out and I'm not doing okay with these procedures. And I don't really want to keep trying. And I would rather do dog dentals or sick appointments or wellness exams. Like cat dentals are just not my thing. And if Dr. Smith is like, hey, no, you just have to do cat dentals, that you're a vet, that's part of your role. If he says that, then I'm going to feel like I don't have control over my job or my responsibilities. And that can feel so stressful and hampering to what you can do. Whereas if Dr. Smith was like, "Oh, Addie, like, yeah, I notice you're very good at dog teeth extractions and super efficient and like instead of cat dentals, like I can't promise you every time that, you won't have cat dentals, but we'll try really hard to make sure that those get put on somebody else's schedule." So, I think that autonomy is huge and just making people feel valued because you're being heard like, "Hey, I don't like this thing and I want to do something different." And the willingness, acceptingness, and non-judgment of the other party is huge at letting you kind of have control over your work.
Yeah. And that kind of brings me to another thing I wanted to ask you about because I saw a lot of things for the team members in terms of like ways to mitigate some of the stressors or causes of burnout. In terms of things that individuals can do to support their own well-being, like staying in touch with friends, having activities outside of work, like getting enough sleep, having a financial counselor, things like that, going to therapy if that's needed. Um, but what about, like, what veterinary practices can do, like, kind of as the workplace to better support the well-being of veterinary team members?
Yeah, I think the biggest thing is to try to create a healthy work environment, and that's, like, easier said than done, right? Like, there could be a whole,
Yeah.
year-long class on helping leaders create healthier clinic cultures, but, at the end of the day, we found 4 factors that were associated with good clinic culture, and that was a strong sense of belonging to the team, sufficient time allotted for high-quality patient care, a high degree of trust in the organization, and candid and open communication among team members. And so some of these things overnight you can try to foster, by trying to create space for your team to speak up about challenges that they might be experiencing. One thing I think I like to tell clinics who might be struggling with workplace culture, who are trying to work on it to be better, is like sit your team down together in a circle and kind of brainstorm on like, okay, what are your stressors right now? What are some of the biggest things that are bothering you about this workplace? But more importantly, what are some of the stressors that we can do something about? Because there's some things in vet medicine, it's like an inherently stressful profession. There's going to be some things that we can do something about, and there's some things that we can't do anything about. And so what are the things that maybe we can do something about, and have the team decide on one of those things to do something about, and have the team come up with some type of intervention to change the thing. And then in a month, kind of reassess and reevaluate where you're at with that change and decide like, hey, is this something we want to keep going? Did this work? If so, let's keep going. If not, like maybe we need to change it up. But maybe also at that month, like maybe we add in another little small change that we can do. And I think when you start engaging your team in creating the positive change, then they take more ownership of it so much, because I think we put top-down approaches on our team. There's going to be resistance. There's going to be defensiveness. Like, oh, why are we doing this? But if you actually involve them in the decision-making process of things that can maybe help improve your clinic and listen to them, then they're going to feel heard and respected. And also, you're going to come up with some ideas for improving your clinic that are actually sustainable, because the ones who are working on the ground, like, front lines are the ones creating the solutions, and they're gonna be more accepting of those. So, I would say that's probably one of the biggest things. I think I mentioned kind of financial pressures and stress for our team members. And so, if possible, like creating opportunities for them to advance within their career. So it doesn't feel like a dead end job where I'm always going to be making $10 an hour and nothing else. And, create paths for promotions. And a lot of this kind of stems because I think some people are like, well, how do I pay my people more? I'm like, well, a lot of this stems on leveraging your team appropriately and running a good business and running a good practice that can afford to give advancement and growth opportunities to your team members. So a lot of this comes back to like, how are you leveraging your team, and are you leveraging to their fullest extent? And what are some of the business things that maybe you as a leader could be learning so that you can really set yourself and your team up for a very successful path forward? So I would say those are just a few of the things. The last thing I would say is if you don't have an employee assistance program, so an EAP or employee assistance program is essentially providing your team with free short-term counseling on mental health things. The nice thing about EAPs is like they're pretty cheap. You buy an EAP and then you communicate with your team, and that way, if any time somebody's having a stressful event in their life, they can access the resources from the EAP for free. But it's not horribly expensive for the practice to buy into an EAP. So I would definitely recommend looking into that as like a benefit for your employees, so that you can provide something for them for mental health, and also like looking into providing mental health coverage and making sure that's part of your health insurance plans.
Yeah, it's such an important thing. And I know, like, at least historically, not every like independently owned veterinary practice has felt or has said that they were capable of offering that kind of benefit. Do you like see that changing? Are you hearing, at least like anecdotally, that that's becoming more
Yeah,
commonplace for practices to offer those kinds of benefits?
that
Or
was one nice thing that we learned from this last study is like it's improving significantly. The amount of practices that are starting to offer mental health coverage on an employee assistance program has increased since we first started doing the studies in 2017. So it's clear that I think practices are starting to pay more attention to this. And I have a lot of hope because of that increase. And not only are we seeing an increase in offering of these resources, but we're also seeing an increase in uptake of these resources as well. So people are actually going to therapy when they need it, versus, it being kind of more of a stigmatized thing that people aren't willing to access the resources. So yes, I think it's a lot of hope that we saw in this last study is around like, hey, we're doing really good on a lot of things here. And I think that's just going to continue to improve as we go forward. And, overall, if we look at kind of overall well being of veterinarians in general, if we kind of scope out um, to the veterinarians versus the team members, like, the well-being of veterinarians is actually similar to that of the general population, and I think that's something that, like, not a lot of people hear about sometimes because 'cause you're always hearing about, like, the bad stuff that's happening and all the bad statistics, but there's actually a lot of things that, veterinarians, have going well for them and even team members, and so, when I look at, like, career satisfaction, we actually saw that, like, vets were like, 75% of vets were satisfied with their careers, and, it was really interesting because we asked vets that same question about their colleagues, and they're like, only, like, 43% of vets thought that their colleagues were satisfied with their career, so we see this mismatch, with vets and with vet team members, and, yeah, I think there's kind of this negative perception around mental health and well-being, but we're doing better, I think, than a lot of people think that we are, because I think that the negative, kind of stands out, sometimes in the sounds that we're hearing from social media or media in general.
Yeah, I feel like I don't know if it's that it's so easy to amplify the negative stories, but I feel like they do get amplified. And so it starts to feel like that's our whole reality sometimes.
Correct. Yes.
Well,
Yeah, 100%, and, I think even with the vet teams, like, if we look at all the team members, like, 42% felt like they were flourishing in this profession, and so there are still, like, a large proportion of our veterinary team members that are doing really well, and, I think for those of us who are doing well, remembering that and being able to, help others that might not be doing as well, and supporting them so that we can get more into this, into the flourishing part of the career.
so is there going to be, is this study going to continue every 2 years? Is there going to be like a 2025 version, or do you know what the future looks like?
Yeah, so this year, instead of a study, we're actually pulling together a group of well-being experts to talk about, what's next for the studies, what's next for well-being in general in the United States, and I'm really excited. We have a lot of organizations represented in that group, and we're doing that next month. So we'll start to really explore kind of what is next for well-being, because we have been doing these studies every 2 years, and is that needed, or do we need to bump out the studies a little farther? And so bringing together these individuals, I think will be good and moving forward. So
It'll be interesting. I'll be looking forward to hearing
yes.
what everyone has to say. I'm assuming it's all going to be shared eventually
Yes, our
with the
plan
rest of
is
us.
to share and amplify. So we're gonna have like a day of discussions and really start to amplify the um, the findings from that group of individuals. So we'll kind of understand what are the themes here, what are the things we can share to the broader world.
And then, on a little bit of a different subject, you shared recently that you have, in a sense, gone back to school again.
Yeah, I think I can't stay out of school. It's funny. I don't think I finally finished the program, and it's funny because I was laughing. I was like, "I think I've been in school since 2019, and it's 2025, and I only took, like, 4 years off when I first started practice." I was in vet school and finished in 2015 and started grad school back in 2019, so I just joke that I'm just, like, always in school. But I completed, my graduate certificate in diversity and inclusion at University of Kentucky, so understanding kind of especially how to inform my own work at MentorVet and make sure that the programming that we're creating is inclusive to everyone that comes through our programming, because we have so many different intersecting identities that come into our program, and veterinarians, veterinary team members, and individuals from all backgrounds, and so understanding how to really make people feel at home and safe in our community was a huge priority for me, which is kind of what prompted me to start the program in the first place. And it was a really great opportunity to just like really understand. diversity and inclusion at a whole nother level because it was all graduate level courses. And so I took like kind of one class every semester for the last, I don't know, 4 years, and to really better understand diversity and inclusion. And a lot of it was kind of related to education and things like that. So yeah, I learned a ton during that program.
And then at the end of the program or kind of like your capstone project, you wrote a series of essays or papers on DEIB. And I read one of them that you posted on LinkedIn where you interviewed 4 experts in the field, like specific to veterinary medicine. And I loved how one of them commented that, because DEI, like, it's become like a buzzword, like for positive and negative, depending on its context and who's using it and that kind of thing. But their comment was something to the effect of like DEI is not about putting unqualified individuals into programs or jobs, but rather about making sure that more of the qualified people have a chance or they're not excluded. And I thought this was really timely given the AVMA Council on Education and their proposed changes to the standards of accreditation that would, as far as I understand it, eliminate DEI reporting requirements for veterinary schools. Um, and as of now, I believe in June, when you and I are talking, those proposed changes are still kind of under review. They haven't passed yet, but there's kind of a comment period where people can go on and leave their thoughts on it. I was looking through some of those comments the other day. There's not a ton of comments, but some of the ones I saw were very strongly worded, kind of on both sides. But there are some statements that are kind of to the effect of, there's no place for DEI in veterinary medicine or in veterinary school admissions. Like, how do you even how do you even respond to like comments like that? Like, what do you do with comments like that as someone who like is really studying the benefits of diversity and inclusion just
Yeah.
within our industry as a whole?
Such a tough question because I think, well, you can't fight it. Like, if you try to fight things like that, head to head in like a rhetoric battle or something, then nobody wins there because, they're already in a reactive and inflammatory space. So nothing that I say or show any kind of research or data, no matter how level-headed that I am, nothing in that moment is probably going to shift that person's perspective, because they're so deeply seated within it. And so a lot of the work that we do at MentorVet is create safe spaces for these conversations so that we're not like hiding behind computers. And, I think there's some safety in this like anonymous. Even like you mentioned before, it's like it feels a little safer when you're virtual to do things. And same thing about, people making comments about this kind of stuff. It feels safer when you're not talking to somebody face to face in a room. And so a lot of the work that we do at MentorVet is try to create this very neutral, safe ground for people to start having these conversations and explore their assumptions and their biases and their perspectives on the world and hear from other people's perspectives and um, kind of create this space to explore so that maybe you learn something from somebody. And I know every time we have a peer group meeting in our community, I'm learning about others' perspectives and better understanding, like, kind of my own biases, and so a lot of this kind of boils down to, like, leading by example, and I think that's, for those of us who may be feeling helpless about changes that are taking effect or have taken effect. I think, for me, if I can just continue to use what little voice that I have, to amplify the voices of others that, I believe in and I think are doing good work. And I think that leading by example in our daily lives and with the people around us or in our communities or in our workplaces and just upholding values of kind of respect and humility, to everybody, and kindness. I think there could be a lot more kindness in the world. And so just starting first with that kindness for others, even in times where it's hard to be kind.
I love the answer so much, and I think I love that idea of like really getting people together, because I think once you get people talking, like they realize they have so much more in common and their goals really do overlap so much more than perhaps they might think when, each of us are in our little silo thinking, I'm for this, I'm against that, I'm against anyone who feels differently than I do on this issue. And like you said, it's such a I don't know, there's such a complex thought and so much that can be kind of really talked out, in terms of what does this mean to you? Like, what is the emotion behind it? What are you worried might happen? What do we really want to grow towards? And I'm glad to see that's starting to happen. Because I think that's a great way to go about that. And just like the idea too that I think there's often a misconception that diversity and inclusion, or DEIV, has more to do with hiring, even apart from veterinary school, even when you're talking about employment, like hiring than anything else, that it's just about who you bring in the door. But I think so much of it is more about like how we treat those people once they're there too.
Correct, and
Um,
so much of the DEIB work is the same as workplace well-being work, right? It's like creating a safe, healthy place for anybody, and that's what it boils down to sometimes. And yes, of course, we do need to, make sure that we are accessible to everyone as a profession. Like, make sure this career is accessible to anybody who wants to be part of it, but also making sure that those that join into the profession feel part of it and not othered, and we can do that in a lot of different ways in our workplaces or as an industry as a whole. So, but yeah, so much of this overlaps with kind of workplace well-being and some of the things that I mentioned before about kind of creating safe environments for people to speak up.
Were there specific examples of like how you see diversity and inclusion sort of incorporated into safe workplaces in like specifically to veterinary practices that you've seen like improvement over the years?
Yeah, I can't think of a specific one off the top of my head. I can share kind of a story that from one of my interviews that one of my interviewees mentioned, and it was something really small. They said that one of their practices, they had like a take what you need basket up in the front lobby and in the back in the treatment area for the team. And so a take what you need basket could be like snacks, water bottles, anything that might maybe, like, for the treatment area, like, maybe there's Advil or Tylenol in there or stuff like that, like, kind of a take what you need, like, here is spree stuff that you can just grab, like, this client just got off of work, didn't have time to stop and get food, they have their 3 kids with them, and, they're trying to squeeze this vet appointment in before their kid's T-ball game, and, oh, the kids are so hungry and yeah, like have a snack from the basket. And it's something that's very small, but like even those small actions can make people feel like, hey, you see me, like you're providing some support. So again, the inclusivity piece, it doesn't have to be big to be impactful for people.
Yeah, that's so true. Because I think we talk about a lot about like just acknowledging that when clients come in and maybe they're upset or they're critical of something, like they're bringing so much of the other parts of their lives kind of with them that we don't see.
Hmm.
But I love that that little gesture is kind of like, okay, we know that you have other things you're carrying, other things that you're juggling, other things that you're stressed about. Here's our little way of sort of acknowledging that and
Yeah.
trying to make that load a little bit lighter.
Yep.
Love that. Well, I wanted to ask you just kind of on a more general topic as we sort of conclude our discussion, like what's one thing that you're really excited about in veterinary medicine? Because obviously you've done so many amazing things already, and I love this new journey that you've been on with diversity and inclusion, and hearing some more about that and how that could be incorporated into your work with MentorVet. But what's something you're excited about, either that's happening now or that um, you hope will happen in the future in our industry?
Yeah, I think in general sense, I'm very excited that, there's been more focus on well-being and DEIB as like this is a necessity. And I think a lot more practice groups and practices are making sure that they're putting resources towards that and focusing on it. I think at like a personal level, the thing that I'm most excited about is this veterinary well-being collective and just getting. I mentioned it earlier in the episode, but we're bringing I think 15 organizations together. Um, and thanks to Merck support, like getting everybody kind of in the same place in the same room and talk about like, hey, what's working and how can we amplify each other's efforts? Because I think for a long time in the veterinary well-being space, at least, we've been all doing our own thing and everybody's doing good work, but it's like pretty time consuming to meet with everybody else that's doing the work and we know each other and we kind of are aware of the work that we're doing, but there's less coordination, I think, than a lot of us would like. And so I think this collective will really create the opportunity for us to start those conversations about like, what is the impactful work already being done? How can we support one another's initiatives and continue to amplify the good work that's being done so that we can have a more cohesive impact? So that's happening in July, and I'm very excited about that, and can't wait to share more in maybe a future episode. So
Well, I would love that. I would love to learn more about that. That's so exciting. Um, awesome. I really enjoyed our conversation, and I wanted to give you a chance to share any final thoughts that you have and anywhere that you can direct listeners who want to learn more about MentorVet and any of the other things that you're doing.
yeah, I would say, you know, I think one thing I wanted to add was just like, don't lose hope. Like, there's a lot of hope to be had in all these, and I've seen life-changing experiences in a lot of our programs that people are having when they get connected to community and others. So, try to stay hopeful, and if you're looking for community and you wanna learn more about the work that we're doing, visit us at mentorvet.net or follow us on social media at MentorVet. We have lots of different programs. We have a lot of scholarships available in our programs as well that make sometimes the seats are free for you. And so if you're interested in joining, we have some scholarship applications on our website as well. And yeah, we would love to have you as part of our community in whatever way that makes sense. If you're interested in just having more people that you can reach out to in times of need. So thank you so much for having me though.
This episode of AHA's From the Soapbox podcast is generously supported by Merck Animal Health.